Well, we tend at Volunteers America to see the broken healthcare system from the perspective of that category that Speaker Gingrich was talking about, that last category of people who need access to long-term services and supports, and they can't get it. And there are 10 million people today who need long-term care. That number is going to be 15 million in another 10 years. Now, 60% of them are seniors, and this is the greatest problem they have. The reason it's a problem for them is that Medicare doesn't provide for long-term care. This is one of the greatest misunderstandings. Medicare doesn't have a long-term care benefit. So it has a small nursing home benefit after hospitalization, but on average it pays like 20-some days. You can get some home care if you're homebound. It's a very stringent definition. So Medicare doesn't provide for long-term care, even though it's the primary health care for seniors. On the other hand, Medicaid does. Medicaid is the primary payer for long-term care, but in order to access it, you have to go bankrupt. You have to get your resources down to $2,000. You can set aside a house with some limited equity in it, but basically you're down to $2,000 of resources in order to qualify. Then all of the income you do have has to go for your health care. You can keep $40 a month. Then, once you're qualified for Medicaid because you spent all your assets down, then you find that it has an institutional bias. Nursing home care is an entitlement under Medicaid, but home and community-based services aren't. So we have the state setting different eligibility criteria for how to get home-based services. We have 330,000 people in the country waiting for home services. So what we find is that we have to help people maneuver this complicated system to get, it's very hard to understand it. They need somebody they can trust to help them. We try to fill that role of Volunteers America, but from an individual perspective, it's a very broken system. Mm-hmm. There are some components that are working and that need to be emphasized. Home and community-based services is one. PACE is another program where you can coordinate the care of seniors who enroll in this program in order to help them stay at home. And PACE allows you to do that. So even though every individual who is enrolled, every senior who enrolls in a PACE program is certified as needing nursing home care, only 7% of them are in nursing homes because you're able to use those monies in more preventive ways, in the ways the speaker was talking about.